And, one of my first red flags was in a group situation where she allowed a white man to go on a racist tirade about the growing Hispanic population in our area. And then when I brought up my struggles with the very real dismantling of Roe v. Wade issues and how it impacts my ability to have rights over my body,
Right.
that was something I was struggling with at that time and wanted to talk about. And rather than allowing me to talk about my thing, she completely shut it down and said, "We're not going to talk about that."
Some of it, I think it got cut, but we can start back with that. So what you do, why you do it, what you do, why you do it, and where you're from.
Right. Hi, I'm Sarah Potter. I'm a late diagnosed ADHDer and survivor of abuse. Currently, I'm a graduate student earning my second master's degree for clinical mental health counseling. And then after that, I'll be going for my doctorate's degree. I'm a therapist in training, a mental health activist, and a human rights advocate. I speak from my real life experiences and knowledge, and I share nuanced mental health advice, and I work towards destigmatizing mental health conditions. And I create content online to help people feel seen and heard. I really strongly believe that through education, sharing our experiences, and having honest conversations about how we're really doing will allow ourselves to find the type of belonging that we've always been searching for and develop a safe space to connect with like-minded humans.
That's a mouthful. That's a beautiful mouthful. The thing that touched me on that was actually say how we are. I know so many people, just quick to say I'm fine, but that's definitely not me. People get a mouthful asking me how I'm doing. But dope. Okay, so kind of like, set the scene. So where did you kind of find, everyone has their moment where they just start, taking mental health really seriously, unless it was just, from the jump. But what kind of moment in life kind of opened that up for you when you started taking mental health really seriously and advocating for it?
Sure. So the first time, I've done therapy. I've been in and out of therapy for like 25 years of my life, basically, since I was a kid. And it was really forced on me a lot as a kid and utilized as a form of punishment or utilized as to justify my family calling me mentally ill or sick and justifying their decisions to really not be kind and the kind of parents that I really needed as a kid. And, with a lot of the abuse that I experienced, some of that just compounds over the years. And you get to a point where you're kind of just like ignoring it and you don't recognize what's happening because it just feels normal. It is your normal. That is how you live your life. And then for me, who I went undiagnosed ADHD all the way up until I turned 32 after my second child, after I gave birth to my second child, but is my third child, to be clear. And it was, I think, 2019. Yeah, 2019. In April, I had what I can only assume now is a major panic attack. I have always been the kind of person to like go, keep pushing through, take on 500 things, 800 plates spinning in the air. Because, that's the nature of ADHD. You go, you do all the things, you have all the hobbies and you make them businesses. And in 2019, I was sitting in a business meeting that I had been going to for about a year, every morning, 5 a.m. Or not every morning, every Thursday morning, 5 a.m. And all of a sudden I started feeling this like really tightness, this like strong tightness in my chest, and my heart was pounding really heavily. I felt like I couldn't breathe. The room was spinning. I was seeing spots in front of my eyes and I'm like, what the hell is going on? I literally thought I was having a heart attack. I had no idea what was going on. So like I got up, I politely left the room. Mind you, this business meeting was a room full of white, staunchy old men who I no longer associate with, but at the time really needed the business to keep myself afloat because I was a single mom at that time, which just adds on to the pile of insanity that I was continuing to push myself through. And As I stepped out of the room, I called my cousin and I'm like, yo, I know you've had some heart issues before, but is this what that is? And he's like, I think you should go to the emergency room. That sounds really serious. So after I calmed down a little bit, I and felt like I could like see and drive and be okay. I got in my car, started driving back towards where my doctor's office was in Gilbert, so I was about 35 minutes away. And I called my boyfriend, who's now my husband, and I'm
Congrats.
like, "Hey, I feel really horrible. I don't know what's going on. I just spoke with my mom, who told me that it's all in my head and I'm making it up. And this feels really real to me. I don't understand what's going on." I pulled over off the side of the road once I got to my town, and he came over, picked me up, took me to the doctor. They're like, "Yeah, you got to go to the emergency room because we don't have the equipment here to check your heart." So went to the
Mhm.
emergency room. They did all of the workup and everything that they possibly could. They did chest x-rays and everything. And they're like, your heart is fine. Maybe let's have you go to a cardiologist and see what's going on there. And my boyfriend and I decided to move forward and try to go through the cardiac doctor route and try to understand a little bit better, he said, maybe why don't we try therapy? Have you done therapy before in like a real sense? Would you be open to something like that? And I said, I mean, I'm open to anything I possibly can get my hands on to better understand like how I'm feeling and what's going on, and kind of dismantle whatever issues I'm having inside.
Mhm.
So it was after the emergency room stay that I went and saw who my therapist is now currently. And she and I had our first session, and I literally just collapsed to the floor. I Outside of the abuse from childhood, I had been in and out of a relationship for a long time. Probably like 2008 to 2014, with my abuser, who is my oldest son's father. And that had been weighing on me heavily, in addition to continuing to deal with my parents, who were not great. Being a single parent, running a business, trying to take care of myself, have a healthy relationship with my then boyfriend, husband now. And I just collapsed to the floor, and I was uncontrollably like crying and super inconsolable. And it was during that appointment where I was met with empathy, understanding, and compassion, and was really just said, the therapist, she said, let's just try to get you calm and to a baseline and teach you some coping skills to help you kind of cope through these things. And then I want to see you every week for a while and continue going through that and seeing how you do. Um, and it's been ever since then that I have actively been in therapy. I have two therapists. I see him once a week, and then I see my original therapist every 3 to 4 weeks now, working on a couple of different things and different aspects of my life to continue to be stable and happy and healthy. Um, I am the kind of person that feels I'm going to probably do therapy for the rest of my life, because it's such a great place to let everything out, process your emotions, your understanding, as well as get to understand the societal and gender based constructs that are preventing you as a person from being able to live fully and be yourself, as well as kind of how to cope with my ADHD. I didn't see a psychiatrist until 2021, after I'd given birth to my second son, where my husband had passed on some videos from Katiosaurus on TikTok, and he's like, "Hey, this feels like you. Why don't you check this out a little bit?" I'm like, "Okay, sure, why not?" Um, and when I went through all the videos, I had the realization of like, "Whoa, this literally explains every single academic struggle, every kind of like social struggle that I've ever had." And holy crap, I think I need to check this out a little bit more and investigate this more. So at that moment in time, the self-diagnosis movement wasn't really that big, and there wasn't a ton of information out there like there is 3, 4 years now. So I chose to go forward with a psychiatrist. And that psychiatrist did all of the ADHD diagnoses, tests, and evaluations. And lo and behold, I have ADHD. And my whole life was explained within a simple diagnosis and understanding how to use that diagnosis as a tool to better my life and overcome a lot of the other challenges that I've had and how to channel that ADHD for good. Um,
Mhm.
but in order to get to where I am now, I had to go through a lot of bad therapists. I had to go through a really terrible psychiatrist who was the one that did diagnose me with ADHD, but also diagnosed me incorrectly with bipolar disorder after I had just had a baby and was definitely depressed, uh,
Right.
which was postpartum depression, very obviously so. Um, with her, she put me on medication for bipolar disorder, and when I was taking it and I wasn't feeling any better with it, I would communicate this to her, and she's like, "Well, I just don't think you want to take your medication." I'm like, No, I am
Yeah.
actively taking my medication and it's not doing anything. Also,
Right.
I'd really like to have ADHD medication because I feel that that could potentially help with a lot of the overstimulation and the inability to pay attention that I continue to struggle with.
Mhm.
Um, and she's like, no, 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 we're going to get the bipolar disorder under control and then we'll go down that route. And I'm like, I'm going to trust the psychiatrist. I'm going to be a good patient. I'm going to do the thing. So I did for about 3 or 4 months. And then it got to a point where she had me on such a high dosage of lamotrigine that I was having increased bad symptoms from the medication. Like it was making me hallucinate and it was making me
Oh my
sick to my stomach. And it was just getting to a point where I couldn't cope anymore. So in my last appointment with her, I communicated these things to her, and she's like, you're just not taking your medication and your symptoms are getting worse because of that. You need to be compliant and take your medication and stop making these symptoms up because that's not what happens when you take lamotrigine. And at that moment in time, I'm like,
I'm out of here.
uh,
What world? How they gonna tell you what you're feeling? That's crazy.
so I never went back to her again. Her
Understandably.
like they did a virtual meeting thing and they transferred me to the waiting room to make a next appointment. I'm just like, goodbye. I'm not even
Mhm.
bothering to do that. So then I went and asked my therapist that I loved if she could make a referral or if she knew anybody that would be a great psychiatrist fit for me. And I ended up founding Dr. Valerie Nickendong, who is originally from I can't remember the northern Africa, somewhere over there. He's mentioned it a handful of times, and I just can't seem to get it the information burned into my brain enough. But he is a amazing, understanding, and empathetic psychiatrist, which seems to be very unlike a typical psychiatrist that I hear from a lot of people. Usually, the
Wow.
psychiatrist is like, "Here's your medication. How are you doing? I don't care. Goodbye. On to the next
Right.
one."
Wow.
And I think that that is the norm, and it's so sad that that is the norm, and that is the norm with therapists overall. And I think when you are a business owner who has a mental illness or has ADHD, it's so important that you have a psychiatrist and a therapist and an outside support system to really help you be successful. And if you don't have those things, then success is going to be a struggle. It's going to be incredibly difficult for you to push forward, meet your goals, set new goals, and really understand how to get your work done. And up until I started taking ADHD medication, those were the things I struggled with. I had a lot of mild success, but I wouldn't say like I was six figures successful for any amount of time because I had a failure to launch because of trauma, and I had a failure to launch because of a non-diagnosed ADHD person just going about their business, living
Right.
life overwhelmed. Um,
Yeah.
so like therapy as a whole is really great, but if you're someone who has had nothing but bad therapists and bad psychiatry help, you're going to believe the stigma that therapy is bullshit, and it really really isn't. It is so important for everybody, I think, especially when it comes to the way ADHDers think, we tend to be very yes or no, all or nothing, black and white thinking, like you're either with me or against me, and that's
Seriously.
all. And
Yeah.
that is a really hard place to continue to live from, because everyone's either your enemy or they're your friend, and there's no in between. There's no room for nuance. There's no gray space to come at it from. And a really huge thing I've learned over the last 5 or 6 years is just you need that nuance. You need that gray space in order to understand how to perceive other people's emotions, how to connect with them socially, and then even more so, how to understand yourself and connect better with yourself so that you can recognize, like, I am burnt out. I need to take a break. My schedule is filled every single day this week. I better schedule 2 days of just nothing but rest and binge watching something on TV, because that is not a healthy way to live, just continuing to go and go and go. It led me to developing chronic illness. It led me to continuing to have this really toxic mindset of, if I'm not doing something, I'm not worth anything. And that worth is something that a lot of people, whether you're ADHD or not, tend to get wrapped up in. You continue to tell yourself, I'm not worthy of running a business. Therefore, why should I promote my business? Therefore, why should I even have a business? I should just go back to a desk job or continue to be unemployed, because what's the point?
Yeah.
And you have to have that inner strength to really peel back and realize, like, hey, I am worthy of these things, but I don't know how to help myself feel that way. I'm going to go to therapy and I'm going to have someone help me get there, because not every person has the perfect family, or not even perfect. They don't have the emotionally mature or healthy family to really help them recognize and understand that it's okay to fail and it's okay to not feel worthy, but you continuously are worthy. And this is the way to help yourself recognize those things. This is how to get back within your own self energy so that you can move forward in success and do things that align best with who you are as an individual.
Oof, that's heavy. That's real heavy. So now, from that lens, so now you kind of painted the lens of, I mean, you talked about your bad experience a little bit, but we talked a lot about your good experience with therapy. Kind of bring me back to that, experience you were talking about when you said, I think it was something you said recently happened,
Um,
or that was
there
a
was
couple of.
something that recently happened last week, actually. But I'll go back a little bit further, because I think that this is really in the teenage years when you are forced into therapy. That tends to be the experience you hold on to, especially
Yeah.
as someone with a neurodivergence. You tend
Mhm.
to hold on to those bad experiences and say, this is what everything is like. This is fact. And for
Yeah.
me, like, I always struggled with my mental health because I had terrible parents. But I also didn't know the tools to help me do better and be better. All I
Mhm.
had was a therapist who believed my parents about me being mentally ill and disruptive, um, and that I needed help and to be fixed. So they put me in religious therapy. And for those who are religious, maybe religious therapy works for you. And if so, that's great. But for me, the healing power of God was just not enough to help me understand how to cope and live in my own life successfully. So I was in and out of religious therapy, or there was one point in time where my mom recommended me to a therapy agency, and then her therapist took me on as a client, which is a major ethical violation and a huge no no. Never attend the same therapist as your parents or your partner or anyone unless it's specific to couples therapy and family therapy, whereupon all of you will be there together at any point in time. And even then, no information is passed on between adults to therapist to the other patient on the other side. And unfortunately, with this therapist, that is what happened. She would listen to my mom complain about me and my issues in therapy and her therapy. And then she would say, well, your mother said this to me about that. And I just want to understand why you think that's the right way to go. So That
Wow.
completely invalidates my experience as a human. That completely puts me on the spot. That demonizes me in the eyes of that therapist because all they're doing is believing everything my mom said. They're not asking for my information or my history or giving me the benefit of the doubt. They're simply looking to fix what my mother said was wrong with me. And that is not okay. And you will have therapists that come along in your world like that may be recommended by a family member. And the minute a therapist starts to say, well, your mother or your father or your aunt or whoever says this about you, explain this to me, that's when you're just like, okay, I am going to leave. You are not the right therapist for me. This is a major ethical violation. And there is such a thing as informed consent, as well as welfare of the client and privacy, and you are violating all of those things. So I'm going to write a report to my state's behavioral health examiners board and have a great day. Goodbye. Um, and if I had known to do that back then, I totally would have done that, because it ruined therapy for me, honestly. And I didn't do therapy for many, many years after that, until I left my abuser, who I was married to, and had a child with, and was just feeling so entirely numb I couldn't connect with the world around me. Go figure. Um, and that therapist, she was really great. My parents at that time, I had to choose to live with them because I didn't have any other options. And I had just had my son literally 2 months before I left his dad. So I had no job. I had a brand new baby. I had no options, and I had to choose to live with my parents. Otherwise, I would have chosen something else. But my parents said, you really need to go to therapy. There's something wrong with you. There was always something. Anytime anybody says there's something really wrong with you, you need therapy to fix yourself, that's when you know that they probably need therapy too.
Yeah.
And you need to choose to go to therapy for yourself, not for other people. And there is a balance to that. We do want to talk about nuance and continue to hold that nuanced perspective. So, um, I decided, what? I am really struggling emotionally, and maybe a therapist who's not my mother will help me. And this therapist was really great. She was kind, compassionate, understanding, and she was more solution focused, which is a very short term based type of therapy. And she really helped me kind of short term fix my mindset, or adjust my mindset rather, to see the larger picture that I was aiming for, which was to live a life free of abuse, to live a life that was for me and my son, and to feel safe and loved, and connected with other people. And, holding on to those few things, I was able to move forward. Now, with this therapist, my parents uh, paid for the first few sessions, and then my insurance at the time paid for another 8 sessions, and then insurance ran out. I couldn't afford $100 a session for this therapist, and my parents were like, you have to pay for it. And I'm like, well, I don't have a job. I'm also a student in college finishing my degree here, so I can't work 3 jobs, raise a newborn child, and also go to school at the same time to pay for therapy. So I can't continue to go. And then that information, was used against me continuously, year after year after year, until I went into contact with my parents. But that's for another story.
Okay.
Um, but after that therapist, I didn't really see anybody for a long time. I did have a couple of behavioral coaches that I tried out. And I think the important thing to understand is that a behavior coach is not a licensed mental health professional.
Right.
In 2009, that is when every single state in the United States required mental health professionals to hold a license, and required them to pass an exam through the state in order to obtain that license. So anytime you're looking for mental health help, it's very important to seek out a licensed professional, especially if you're going for a diagnosis. You need someone who has those credentials. And I hold the position that, self-diagnosis is valid. If it gives you the ability to self-diagnose, to use your diagnosis as a tool to help you better understand how to go about life, then that's really great. But if you're looking for job and school accommodations, you have to have the clinical diagnosis from a licensed professional to have that validity.
Right.
So both things can hold space, and that's kind of the whole position of a good therapist, is that they validate that you can also be super pissed off at this person and also still love them. Both things can exist.
Mm-hmm.
So, the behavior coach was still really helpful and really great. They really asked a lot of good questions to help me understand how to overcome some of the issues that I was experiencing in my life, and some of the emotional struggles of post divorce that I was still going through, as well as how the hell to cope as a single parent. Because there's like not enough literature out there that actually talks about how difficult that is, because
Yeah.
it's not just about financially providing for your kid, it's also understanding how to parent. And when you have shitty parents to begin with, you are not going to really understand how to be a good parent unless you've done the work previously in therapy or what have you to get to that point. Then the psychiatrist I mentioned, that was my next jump forward to bad mental health
Mm-hmm.
help. Anyone who tries to tell you, like, you just don't want to be compliant with your medication when you are being compliant, and tells you that you're making up your symptoms to stop taking medication, that's when you just want to be cutting the cord, leaving,
Yeah.
goodbye, not
That's
interested. Um, and continue to advocate for yourself to have mental health professionals that really are on your side and are there to help you while also calling you out on your shit.
yeah.
Because that is an important element of a good therapist. They are kind, empathetic, and provide unconditional positive regard, but they also hold you accountable. That
Yeah.
accountability is really what is going to help you grow. Now, the most recent bad therapy experience is one that is currently under investigation still.
Uh-oh.
Um, I reported the individual to their supervisors and boss, and then I also reported them to the Arizona Behavioral Health Board of Examiners because of their atrocious behavior in a group setting.
Right.
Um, I have attended group therapy myself.
Mm-hmm.
It is something that I do want to destigmatize really quickly. So, a lot of times when we think about group therapy, we think, oh, it's for addicts. Oh, it's for people who are seriously mental ill. And that is just not the case. There are people who are trying or having a hard time coping with the death of a loved one. There are people there who are struggling with their gender identity and they're just looking for support. There's also people who have familial struggles where they're looking for support. There are people who are mentally ill that are there looking for support. There are people who have experienced a horrific injury that's left them disabled that need support. Really, any life changing event is a great starting point for attending a group therapy service for a short amount of time, because it gives you that connection that you need. It helps bring similar stories into your life that help you feel seen and heard. And it also teaches you through psychoeducation how to better yourself and really start to grow.
Right.
So, in this group therapy setting, there is a day group and a night group. I prefer to attend the day group because that therapist is great. They're everything you want in a good therapist, whereas the night group tends to be pretty questionable.
Mm-hmm.
And um, one of my first red flags was in a group situation where she allowed a white man to go on a racist tirade about the growing Hispanic population in our area. And then when I brought up my struggles with the very real dismantling of Roe v. Wade issues and how it impacts my ability to have rights over my body,
Right.
that was something I was struggling with at that time and wanted to talk about. And rather than allowing me to talk about my thing, she completely shut it down and said, we're not going to talk about that. It may offend other people. When just
Wow.
previously she allowed this dude to go on a racist tirade.
You're in the wrong room. That's a crazy place to be.
And
Sheesh.
what really blew my mind a little bit is that this person is a woman of color who
Whoa.
allowed and facilitated a situation like this. So
Mm-hmm.
that was my very first red flag. I'm like, I know that this person has undergone some trauma. I'm going to give them the benefit of the doubt. Maybe they're just trying to appease to the white men in the room because that's what people tend to do. Maybe
Yeah.
just going to let this go and we'll continue to go. But letting go doesn't always mean you have to not document what's going on. So
Of
I
course. Yeah.
continued to document, but I tried not to hold on to emotional resentment for that. And then there were a couple of other situations where the white men in the room would go on tirades about their crazy or psychotic wives or ex-girlfriends and current
Mhm.
girlfriends and justify their craziness as a means for continuing to demean them and tear apart their characters within the group therapy setting. And every time I, as the one or two females within the group, would stand up and say, "This isn't okay to talk about women this way," I don't understand why I, the patient, have to continue to advocate for the proper way to discuss women and your struggles with women in the group. But here I am. Can we please not talk about women this way? Because it's incredibly disrespectful. Um, and she would either shut me down or she would completely ignore the situation and move on to something else, which in a group therapy setting, a group therapist should continue to allow both sides to speak, to be heard and
Mhm.
listened to gain better understanding of one another and each other's positions, while also facilitating a safe conversation and space for everybody. A bad therapist is going to shut down one person or both and move on from that. And in some cases, to continue nuance, it is the right move to shut it down and move on from it because it might just be going down a bad route. However, there are always going to be times where it should be encouraged and it should be discussed. And if you have a therapist, whether it's in an individual, family, or group setting, who shuts you down anytime you bring up an issue that you have with someone in the room or the therapist themselves, that's a red flag. I need to find someone else or complain to a superior or a supervisor they have who's going to help me advocate for myself, because me advocating for myself in this situation is just not happening.
Yeah.
Then, those were some pretty similar situations with this female person of color therapist in the room, which was really surprising to me, of
Yeah.
siding with the white men in the room pretty consistently. So then we flash forward to last week, and in any kind of group setting or any setting at all, I like to talk and I like to share my perspective as well as say, hey, this person's perspective isn't being talked about enough. What about this person? Or what about this type of situation?
Mm.
We need to
Okay.
bring the conversation to everybody in the room. And I try to advocate for others and myself within the setting. Um, and last week, I decided, you know what? I'm going to peel back because this week's topic is about perfectionism. And I always try to be on top of everything and keep the conversation going because that is my perfectionism driving me. So I'm going to peel back and I'm going to practice silence and allow other people in the group to speak more than I usually do.
Right.
Apparently, that was not a good move
Oh.
because in the group, it became very hostile between the therapist and the group members. Um, we like there are going to be people in our lives who don't want to talk, who prefer silence and learning and observing and understanding, and that's
Right.
how they choose to interact, and that's fine. Um, but if you are in a therapy setting and that is your choice, and there are other people who are also choosing silence, there comes a point in time where the therapist can begin engaging the group a little bit more ethically, versus stating out loud, wow, this group is terrible tonight, and not helping people understand why she was leaving large gaps of silence. So the group started out with her stating all the rules of the group and then finishing up with, if you don't want something you say to someone to get back to me or other people, maybe keep your mouth shut. And I'm just like, why would you say that? That's
What's going on? Like,
And in my mind, my therapy training mind, I'm like, something bad must have happened to her in the recent week or like today where she is just on the defense. We're gonna give her the benefit of the doubt. We're gonna let her have some grace, and we're gonna move on. Then, throughout the group, she just asked us yes or no questions, and she would speak directly to the material and not really engage us in the conversation. Or when she would, like I mentioned, it would be a yes or no question. So some people would be like, yeah, this was easy for me to understand. Or like, yes, this helped me understand that better. And then that would be that. And then we would sit there for 2, 3, 4, 5 minutes. And I got to a point where I'm like, I'm going to count how many minutes of silence we get each time this happens. And this last time, before she said the rude comment I mentioned, we had sat there for 5 minutes in silence. And at that point, I felt, you know what? She's pushing us into this silence on purpose. And it doesn't feel like a technique. This feels like punishment. This feels wrong. And me being open to everyone's different technique and everyone's different perspective on how to approach therapy, just it didn't feel like that. So when she said the rude comment, I being an expressive person and having a hard time being able to hold back my emotions, I made a weird face. And she immediately calls me out. What's with the weird face, Sarah? And I'm like,
Sheesh. She's
okay,
was on the
we're gonna
road.
we're gonna go down that road. And I said, I just feel like saying that is really inappropriate and super rude to a group of people who are most likely traumatized already or struggling with something mentally, and you making that comment just makes them feel worse.
You're right.
And her argument pretty much the whole time was like, well, it is a technique. And I'm like, the way you're using it is not a technique. This is punishment. This is gross. This doesn't feel okay. And me also having going through training for becoming a therapist, I also understand that it's important for counselors and therapists to hold unconditional positive regard, which just means being open, communicative, empathetic to your client, and giving them the benefit of the doubt. And I mentioned that to her, and she said, well, I'm the therapist in this room and I decide what my techniques are going to be. And I understand what you think is supposed to be good therapy, and I don't agree with it. Not to mention, therapy here is not supposed to be all positive and sunshine and rainbows all the time. It's going to be negative. It's going to be challenging. And if this was a therapist, and I've seen examples of a therapist providing this information in times before to their clients. They do it calmly, peacefully, with an open question of, can you share more about why this hurts you or why this doesn't feel okay to you? Being an open and understanding person. And there was none of that. It was, I'm the therapist, I make the rules, you obey, or we're done. And there were other people in the group who also spoke up and said, yeah, this makes me feel like a third grader. This makes me feel really uncomfortable, and it doesn't feel okay. And she continued to double down and defend herself, and it got silent for a minute. So I unmuted and I finished with my comment of like, this isn't okay. We're not saying you're not a good therapist. We're saying that what you're doing is not okay. It feels wrong, it's mean, and it's hurting us. We are literally speaking out and sharing that with you, and this should be a safe space for us to do that. And she had been talking over me many times before this, and then when I stated that, she continued to talk over me and begin to raise her voice more. At that point, I was shaking with anger so badly, and I could feel my face was just flustered. I was sweaty. And those are some of the telltale signs for me of like when I'm getting really angry and upset. So I just said, this is ridiculous. I'm leaving. And I kid you not, from her seat in the room, she raises her hands, bye, Sarah. And I'm like, wow, what is this?
Why are you here? Why are you in this field? This
Right.
ay, ay.
And then she proceeded several hours after that to send me and her bosses an email saying that I was being a disruptive person and that I wasn't being respectful of the therapeutic space and that I was disrupting the therapeutic alliance and all this stuff. And I think there are going to be a lot of people in this world who encounter that kind of BS in therapy, whether it's in a group or individual setting, and where your therapist is going to try to, for lack of a better term, gaslight you into
Yeah.
thinking that you were the problem and they didn't contribute to that problem at all because they're the therapist, because they're the
Mhm.
one with the license. And that is a horrible use of power. That is that like the power dynamic within the therapeutic relationship should always be egalitarian, which means to be equal, to approach conversation from the patient being the expert in how they think and feel, and the therapist being the guide, the person there to help guide them towards a better style of
Mm,
life. And if you're a therapist listening to this, and if you're a therapist at any point in time in your life, or you're thinking about becoming a therapist, you really need to think about, why do I want to do this? What is the motivating power behind me becoming a therapist? Because if it's just for ego satisfying reasons, maybe it's not for you. But if it's
yeah.
coming from the perspective of like, I had harm done to me and I don't ever want to have someone go experience that. And if they do, I want to be the person there to support them and help them and know that it's okay to feel how they're feeling. Then that's great. As well as many other different perspectives that are very open minded and positive. But if at any point in time your ego is a part of your decision in becoming any kind of care provider, whether it be medical or mental, you really need to take a step back and uncover why. Because it's going to lead you to causing harm to your patients. It's going
Yeah.
to lead you to possible misdiagnoses. I think, if we want to talk about um, Black boys, Black young boys, for an example, therapists, specifically white therapists, are still diagnosing these young Black boys with a defiance disorder
Mm,
because they're speaking out and they are trying to advocate for themselves, just like their other white school classmates might be, or whatever other group setting they might be in. And that is because we're not looking at providing care to young children, specifically children of color, through the lens of equality, through the
yeah.
lens of trust and care and
Mm,
empathy. And if we ourselves, as the provider in any setting, be it a coach, a business owner, a service provider, whatever, if we are looking at people of color and thinking, well, there's something wrong with them, there's absolutely nothing wrong with me, that's a problem.
yeah.
That is a problem with you and your whiteness, and not being able to take a step back and
Yeah.
recognize this is some white supremacy bullshit that I'm filtering in, and that's not okay.
That's huge. And I'm like the biggest, and most of us, and again, thank you for just everything you say. You're just constantly dropping gems. But I'm always just a natural devil's advocate, even with things I don't agree with. But like, I've time and time played with like, if I was raised by someone who's racist, because I had to look back when I was raised by my parents were homophobic. So it
Mm,
took me having to meet a gay person. And like, I had a bad experience my first time because I was being immature. I was in sixth grade. My parents, every time someone gay kiss, go ew. So I'm like, my
right,
one of my best friends, I finally found out from someone else. He didn't even tell me. And I was just more so hurt that he didn't tell me. But it made me have to look in the mirror. I'm like, why didn't he tell me? And
right,
it just sit me down. But I'm like, I understand it. That's why I try not to have so much hate, as a lot of my friends might have for people who are racist, because a
right,
lot of them maybe might be choosing that. But I do know that what you're taught is when you normalize something, it's hard to break out, especially
right.
if it's something that you benefit from.
Yeah,
It's like a prideful thing.
right,
But that's I always just love to get different perspectives on it because I know that it's like it could be a sickness. I feel like at times
right.
where it's just like they're just stuck in it. It's like a delusion. Because I
Yeah,
mean, just imagine just thinking because of the color of your skin you're better or worse than anyone. It's
right.
just it's crazy. But the
Right.
other thing I want to touch on, because it's something that, I mean, I don't have kids, and I'm terrified just because I have long stories about my depressive times where I was, being impulsive and just losing myself, becoming an alcoholic. Literally, one of my cats passed away because I didn't leave my room for a week because I just couldn't,
Mm-hmm.
and I almost could have passed away, at that time, and
Mm.
just going through a lot, and it makes me get scared for, having a kid, because I do go through those lows can get low. But
Right.
you are our second ADHD parent. We had our guy Chris Redding. He's a Grammy considered ADHD artist. He made a album to connect with his non verbal autistic son, which is
Such a
beautiful stuff.
beautiful thing. Yeah.
Just beautiful stuff. But you are a second ADHD parent. I want to kind of just ask for just any gems you can give to the audience for anyone who has ADHD, anyone with ADHD who's gonna end up having kids would need it, but just in people
Right.
who already do have those kids.
Yeah. I like that you mentioned that you're terrified of it
Yep.
because as the parent now, I'm still terrified.
Oh man.
There's like I have two children who are preteens and they're going to be teenagers, and like I used to run youth groups with teenage kids. I connected really well with them, and now I'm like, I have no idea about teenagers. I have no idea how
Yeah.
to connect with a teenager or like be cool with one. I feel very out of touch with teenagers.
Mhm.
And then to contrast that, I have a 2.5-year-old child, like two
Right.
very opposite ends of the spectrum. One is still going through developmental things, and the other two are like off having social lives and wanting to go do fun things and be in sports and have all these other big dreams.
Right.
And for me as an ADHD parent, I get very overwhelmed by having three kids. Very overwhelmed.
Yeah.
Um, my daughter is my stepdaughter, but I call her my daughter because I don't think she's with us all the time, and I'm really the one kind of raising her with her biological mom, seeing her every now and then.
Yeah.
Um, but I have that to combat with. And then my oldest son is autistic. He
Oh,
is a loving, caring, compassionate child, but he can also go to the other end of the spectrum and be really angry and like
see.
having a meltdown and
Yeah.
raging at me. And like I think I asked him to fold his laundry one day because that's the skill we've been working on, and he screamed, "I hate you, mom. I don't love you." And I'm just like,
Sheesh.
okay, well, I know that you don't feel that way. I know that you're upset right now. I'm just gonna walk away and be like, okay, well, I love you. If you need to talk about how you're feeling when you're in a more calm state, or if you want me to help you calm down, just let me know. Um, and then literally 5 minutes later, you'd be like, I'm sorry I said that, mom. I didn't mean it. I love you very much. You're my favorite person in the whole wide world. I'm like, I know. It's okay. Sometimes we have big emotions and we have to talk about those big emotions and say,
Yeah.
I have a lot of big emotions right now. I'm angry you're making me do the laundry and it's stupid. Those are fine things to say.
Yes.
And so, like, the way I've been therapized and the way I've been coached in my life, I try to take that and apply it to my kids. And then with my 2.5-year-old, he's really like four 2 year olds in one. He's just a ball of chaos. Pretty certain he is probably ADHD. Um, has all the classic signs of a little boy with ADHD. Um, and so managing all these really big personalities and all three of these different kids who have different issues that they're coming from. My two older ones have different parents, and my younger one shares my husband and I. So we have, a blended household, and it is a huge challenge. But it is also really rewarding and really beautiful. There are so many wonderful things that I've taught my kids. Like me being a political activist and a mental health activist and advocate, I talk a lot about politics in the house, and I talk a lot about how politics and race and religion kind of impacts our view of the world, and how
Yeah.
the things that have hurt us in life also impact our view of the world. And I work to help those kids understand that all of the things that happen to us, all of the people we experience in our lives, all the connections that we build impact us, and how we choose to respond is our responsibility, no one else's. Our emotions are our responsibility. We can't blame mom for our emotions. We can't blame dad for our emotions. We have to take responsibility for our emotions while also recognizing that there are societal and political aspects in our lives that deeply impact our ability to have those responses, to be able to cope and manage. It's like, it's so if we take our kids and we just say little humans, and then we also have bigger humans, we can't look at them and say, like, oh, you large human, you're not allowed to have these feelings, and you don't get to blame me for these feelings. Look at what you did. You chose to go and smoke pot. You chose to go and buy drugs. Like, that's your fault. You can't blame anything else. We're completely negating the societal and political systems putting that person into that position, into those choices. And in negating that, we're completely refusing to acknowledge that our actions and behaviors have an impact on other people. And it's the same with our kids.
Yeah.
We, as the adults, are responsible for modeling how to behave, how to respond. And if we are not being good models, if we're not behaving and responding in healthy ways, those kids are going to take those on. They're going to absorb that. So, like we were talking about a little bit ago, if, you know, there are a lot of racist, horrible, mean people with bad attitudes and bad behaviors out in the world. They were not always like that. They were taught those things. They modeled those things after the people that raised them or after the people they looked up to. And if we don't recognize that we are literally shaping our children through our words, emotions, and behaviors, we're going to continue to fail them. So
Yeah.
when we think
Feel
about,
the world, you know.
right, fail the world. So if we want to think about, like, how do I overcome being terrified of parenting? You don't. You just do it scared. You
Yeah.
do it knowing I'm going to fuck up sometimes. You do it knowing I'm going to be amazing sometimes. You can have both aspects take up the same space. And that's what brings us to a nuanced perspective. Being able to approach every single thing in our life with gray thoughts and nuance, which I used to not be great at. I used to be really bad at it. And then I went to therapy and then I learned how to do all these things because I wasn't taught as a child. I had not great things modeled for me.
Mm.
And you know, now that I've really opened my mind to understanding all of the systemic issues that are holding people back, people of color, people of different genders, then I can really begin to empathize with other people and then help my kids understand how to do that too. So if you have kids already and you're like really questioning whether you're a great parent or not, just watch your kids and how they interact with other people and how they behave in the world. If you have a kid who's bullying other kids, or if you have a kid who is going above and beyond for kids who don't deserve or respect that child and their time, then you might be raising a people pleaser, or you might be raising a bully.
With me, I was the people pleaser, still trying
Same
to.
here. I'm totally a people pleaser in a lot of aspects still, especially
Yeah.
with my kids, because I don't want to mess them up. But
Yeah.
that's that fear. Recognizing that you have fear about having kids and recognizing that you are scared while raising kids is so good. It's such a healthy
Yeah.
thing to do because then you can take that information and be like, okay, what is it that I'm afraid of? What am I so scared of with either having children or raising my own kids? How can I address those issues? How can I better myself surrounding those issues so that I can feel more confident in being a parent? And I think the last thing I have to say is that you're going to mess up your kids sometimes, and that's okay. We all make mistakes. We all have toxic behaviors.
Hmm.
But the important thing that you do is that you recognize what you did or what you said, and then you do the effort to repair. Kids
Yes.
are going to remember the repairing aspects that you go for versus what happened to them. So if you
Oh,
did something bad to them and you never said, I'm sorry, we don't do this. This is what I meant. This is what I wish I would have done. This is what I'm going to do going forward. They're going to remember the bad stuff. And then that's all you're going to be to them is bad stuff. So you have to repair your kids. You have to repair that relationship that you may have damaged in an argument or may have damaged in your own frustration with something else you have going on in your mind that the kids have absolutely no idea about at all. And that, I think, is what makes parenting okay and easy to do, is knowing that you're going to mess your kid up anyway. But if you say, if you apologize and if you come at it from compassion and understanding and empathy and repair what you broke or repair what you did, that child is going to understand it's okay to make mistakes as long as I work hard to fix them the best that I can. And even if I can't repair it the way that it once was, I still did my best. And I still did the best with what I could and what I had. And that is parenting. Just knowing you're going to mess up and make mistakes and doing everything you can to mitigate harm, mitigate risk. It's kind of how I approach therapy with clients, is like, you know what? There's going to be a lot of things that I might say or a lot of things that might happen with the client that I have to help them understand. Like, hey, we all make mistakes. Let's talk about how we can avoid this in the future. Let's talk about how we can help you cope with this, not ruminate on it or beat yourself up about it. Because when you do that, you're just going to continue to perpetuate that negative behavior and that negative mindset.
Man, and I love the fact that you're also a therapist, and I feel like that's a beautiful. I feel like all neurodivergent people should be therapists, or just the ones that have that extreme empathy. I thought about therapy, but my empathy runs too deep. I couldn't sleep at night with some of the things I've just heard. When a lot of times as a coach, we end up as therapists even when we're not in that field, because it's like I'm asking, especially with my clients, I focus on ADHDers, and I'm asking how things are going. We have to talk about, I have to figure out what's going on in your mental, because sometimes we can't even proceed right now. Like, it's not a good time to even touch the business. We need to get that stuff going, otherwise you're going to ruin your business, because you're jumping on calls, you're erratic, so we have to find, and it's really hard. It's really hard to deal as an entrepreneur as well. But that was kind of the last thing I wanted to get in with you, just, trying to find your way. I know you've been able to monetize a lot of your, your talents and, your skills and things that you picked up on. And just kind of walk me through that, because that part of our show is like really important to me, because a lot of people are told that if you're, neurodivergent, even if you're not neurodivergent, people just can poop on not therapy, but can poop on entrepreneurship for people who just have any mental challenges. And I talked about it in one of our episodes, but it's so hard to, for one, go take an idea out of your head. Like, that's a super hard thing to do. And then once it's like, okay, how do I make money from this? Being able to tell someone that you want to start a business and tell that same person that you don't know what you're doing, that's just so embarrassing, and no one wants to do it. But none of us at the beginning know what we're doing. So I do want to just kind of walk through, or you can just kind of explain your journey from like, okay, now I really know what I'm doing with this online space, even from, the content creation, from zero to like where we are now with our platform. Kind of like some challenges and like just some best practices for people trying to monetize themselves online.
Sure. So when I ran my marketing business, I really focused on in-person connections before COVID-19. And once COVID hit and it all had to be online, I realized I have no idea what I'm doing really right now. I can't make a connection with another person. Like, my social capabilities, because I would just chameleon myself to other people. I'd be like that people pleaser, like, oh, this person really likes to talk about baseball. I'm going to talk about baseball all the time with this person, because then they'll give me their business and everything will be fine. And that's really manipulative. That's not really doing good business. That is just you convincing someone else that you care about the stuff they care about, and then taking their money and doing the thing. Now, for me, like, I, of course, executed the service and I did it as the best that I could and all of that. And that's great. I think the real challenge for ADHD business owners doesn't come from getting the idea and then making it into a business. I think that it comes in the execution part of it. It's that executive dysfunction aspect of it where we tend to have that disconnect.
Yeah.
Um, and I know, like, for me with my mental health business now, so I'm working on getting my licensure. I'm in grad school earning my master's in clinical mental health, and that's just one part of the goal. The other aspects of the things that I'm working on, so I have my online content creation, and I work on monetizing that through subscriptions on Instagram, which
Okay.
means I have to first set goals to hit a certain follower mark. And
Mm-hmm.
then in order to hit that follower mark, I need to also understand what kind of content really hits it for these people that are following me, that are engaging with me. What is it about what I say and what I can do they latch onto? And how can I take that and expand on it while
Mm-hmm.
also continuing to hold their attention? So a lot of it comes into it comes down to research, your ability to do research,
Mm-hmm.
psychology, being able to understand and empathize with other people is so important. I ran a marketing business for 13 years, and that knowledge doesn't ever just stop growing with me. Like, I continue to utilize it and learn for my own business's purposes, but
Mm-hmm.
you really have to take a step back and do some psychology courses. Whether you do an online course from someone you know, or you start learning about it on your own, or if you're like, hey, I'm going to go to community college and I'm going to enroll in 2 psychology classes because I really want someone who knows what they're talking about teaching me all these things, and then I'm going to go and DIY it a little bit more. You have to have that element of it. If you can't understand other people, you're not going to be successful, because you are just going to assume that everyone thinks and feels from your perspective. And that is really blinding yourself.
Yeah.
So, becoming a researcher, understanding human psychology, and then applying that to making sales. Once you're able to understand how the human mind works and what that reward and gratification system is like, you can then apply it to your content, and then you can then apply it to whatever business you're selling. So, we all have different motivations. So for my audience, the motivation is to better understand their mental health and learn all about trauma and ADHD and how to heal. How to heal is really the cusp of what my audience is looking for.
Mm-hmm.
So I how I came to that was I posted a bunch of content. I looked at the viewership, the engagement, meaning the likes and comments, and what people were saying in the video comments. It's not just about, oh, I got
Yeah.
100 comments. Great. I made a post about Palestine the other day and it was just a bunch of hate.
Mm-hmm.
That is not the kind of engagement you want. You want
Right.
engagement that really focuses on how that is helping the person. So
Mm-hmm.
when I published a video about how I felt like I wasn't being seen and heard, and then when I did start feeling seen and heard, how it changed me and how it really empowered me. And then from understanding how that impacted me, I looked at the comments of the video. Did other people feel the same way? What was their experience in watching and listening to this video and this audio? And how
Mm-hmm.
can I take that feedback in those comments and apply it to future content to continue to get people to be engaged? And then once you hit your follower goal, like just pertaining to online business content creation, then you can start opening up subscriptions. But before you even begin to be like, hey, I offer a subscription, join my
Mm-hmm.
subscription club, you got to have stuff for subscribers that
Yeah.
is worth paying money for. And that could be, you teach them how to heal. You teach them the 4 tenets of your business, or the 4 aspects of your business that people really like. And you continue to make content on that helps people hit their goal of healing or recovering from trauma or learning coping skills on how to deal with triggers, as well as how to understand other people and build empathy for others.
Mm-hmm.
And in doing that, you're creating value for people. People are always going to look for what value you offer. Sure,
Yeah.
you have a really cool t-shirt and it looks really cool, But how is it going to add value to my life? Does it fit my vibe? Does it fit my persona? Does it also help me feel comfortable and cozy? Is it itchy? What is the screen printing on it? Is it soft? Is it hard? Is it an iron-on? Is it fabric? Is it stitched? Like, all of these things are questions people ask themselves when they're reviewing just a piece of apparel. And ultimately it comes down to, is it comfortable? Is it going to fit my vibe? Yes. Okay, I'll buy it. And then move on. Obviously, there's going to be more elements to that in terms of human psychology you'll want to understand, but for the sake of the podcast, we'll just simplify it a little bit. Then, another aspect of how I monetize is on YouTube. So right now I have a really small subscriber bunch on YouTube. And what I have a goal for this year is to create more long form content that I can not only post on YouTube, but also cut up into snips and tease out on Instagram, or that does have really good value in a small amount of time, but also, hey, there's more value in this long form piece of content if you go to YouTube. The more views and the more subscribers you gain on your YouTube channel, the more you continue to earn, as well as selecting monetization options within every social media platform. I don't try to focus on brand partnerships. I don't focus on every person who emails me and wants to do a paid collaboration, or here's a free product and talk about our product and you'll get the free product. I don't do those things because those aren't valuable to my customers. Maybe the free product is valuable to me, but how is it going to give value to my customers? Like, I had a weight loss surgery center reach out to me and offered me like $9,000 in free weight loss services. And I'm like, while that would serve me greatly and would be great for me, it doesn't pay me anything in the long term. It doesn't provide value to my followers who are just struggling with being who they are, and telling them, hey, let's do this weight loss stuff. That's just going to add to the lack of self-confidence and self-awareness that they already have. That's not going to be valuable for them.
Right.
And I had a brand recently who gifted me some notebooks that had funny sayings on them related to empowering yourself and making light of some of the struggles you have. So an example of one of them was brilliant ideas people told me would never work. And, that is a really important part of being a business owner, is being like, you know what, I have all these ideas, I'm going to write them all down. And because when you say them to other people might say like, oh, that's a really dumb idea, no one's going to pay for that, or you can't be an artist, you're never going to make enough money. And you don't necessarily, when you're starting your business and learning to monetize it, you don't want to open yourself up to harsh criticisms like that, especially if you don't have a rock solid idea and plan for executing that idea and reaching the goals associated to that idea. So being able to just word vomit them all over something is incredibly invaluable. So I chose to go with that brand partnership, which they don't require me to post anything. They don't require me to do anything. They just gave me a gift, and that was it. And that's a great kind of thing to do. I may publish something about them. I may not. I haven't decided. But a lot of people think, oh, when I have 100,000 followers, I'm going to get tons of brand deals and I'm going to partner with all these brands and get sponsorships and things like that. And that's just like not the case. You get a lot of trash mail. You get a lot of offers for, we'll give you free things if you take all your time and energy to creating a high quality content post for every social media platform available. That is not worth your time. That you're not getting paid for that. And the product that you're getting probably isn't going to really be a home run hit with your followers. So maybe don't do that. Don't focus on the brand sponsorships. Don't focus on brand collaborations and deals. Those will come, and you're going to have to pick and choose the ones that are going to be right for your audience and your mission and your goals. And I think that's been a really huge part of my success in monetizing is I focus on the main mission, which is to help people feel seen and heard and heal. And if the brand or product doesn't do that, I'm not interested. because my mission is about the people. It's not
Yeah.
about me. And I think with neurodivergent people, we can get really caught up in our minds and we can get really caught up in ourselves and think like, oh, this is so great for me. It's that impulse control. Like, yes, hit
Yeah.
that dopamine. Give me all the dopamine possible. Yay. And then it falls flat. And then it's not successful. And people don't care. And then we feel the low lows. We get really
Yeah.
depressed. We get really anxious. And we completely disregard anything in the future. And our self-worth continues to plummet. So understanding that monetization isn't just about being a social media famous person. It's about providing value to people who connect with the mission you set forth to execute on. And that's really what I focus on. I have a couple broadcast channels on Instagram and I have a subscription, which I have a plan and a strategy for, but I paused it when all of the things with Palestine started going on because my mission then diverted to awareness, knowledge, mental health, and really been focusing on that. And that was a financial choice that I made to forego that income. And I think, that's another important element of monetization. There may be things about monetizing your brand and yourself that you just let go for a time because there's a greater purpose that you want to serve.
I love that.
And yeah, I think that's kind of all the brain space I have on monetization. I have a lot more like strategic based ideas and thoughts, but I think really getting into the mental emotional aspect of monetization and doing it right for the right reasons is so much more important than the how to do it. Because if you know how to do it, but you don't know why you're doing it, it's not going to work.
Yeah. I love how you explain. I mean, I love how we explain things. We usually give you a really good picture. We never, sell anything short. So I really appreciate the depth you went into. I feel like I got everything, kind of in like a nutshell. But yeah, just to kind of piggyback and just, leave them with something else just for entrepreneurship and just for, the business side. That's something I love business because I love psychology and it's a lot of the same thing. I love sales because I've done the really bad sales, sharky sales, and I couldn't sleep at night. And I saw what that did. And then I found a way, an ADHD friendly way to sell, that just really, I just tried to attach myself with offers that had value because I was selling offers that I had to lie. I had to get out of character because I need money. It's not working, with the script that they gave me. So now it's at a point where I really just provide value on a call, give them some free stuff and ask them, what do you want to do next? And then they usually say, oh, well, I mean, do you sell something? Like I never even drop a price or anything anymore. And it's just so much more, just so much better, because I feel like you can't make anyone make a decision anyway. So it's honestly the same outcome. My close rate didn't go down once I started that. But I can talk about sales all day, but the one thing I wanted to touch on was the 6 phases of business. Cause like, since I've failed a lot and I've had a lot of failures in business and I've, finally have some successes that are starting to push through. And what's worked is just the 6 stages, 6 phases rather, of business. And we're actually teaching in this boot camp, the 6-week boot camp. It's going to be a week for each phase, starting on the first. But first is target audience. And I mean, everyone is going to make sense to you for sure. But first is target audience, just knowing who you're going to serve and why you're going to serve them and figuring out, like, if you have to have a sales process, if you're going to have to be on sales calls with these people, making sure that this audience is conducive to your mental health, not picking people that wouldn't like you. Because my mom is a lawyer, and I was like, I know lawyers. I know what makes them tick. I know that a lot of them just suck at content creation. They're not creative people. They're super boring. So I'm like, they might need me, but they ask too many questions and they make me scared and they fit very condescending. So I'm like, no, I don't want to do this unless I can build a sales team, and it wasn't the time. So target audience, when I teach, people who have ADHD, I make sure that they, keep in mind. So if you want to build a page like this ADHD page and you're someone who thinks ADHD isn't real, so you're not going to have fun. You're not going to have fun with that at all. I get a lot of DMs of people just telling me ADHD isn't real and stuff. I'm like, like just go somewhere else. Like someone joined my life just to tell me it's not real. I'm like, it's like looking a cancer patient in the face and saying, it's like, dude, this has been running my life. But it's very, very, very important to target audience first, because then if that's not right, everything else just crumbles. But then next we have offer creation. So many people struggle just packaging up what they do and presenting it to someone. Like, you're really good at this and you just can't, get it off the page. So offer creation is huge, having low ticket, medium, and then eventually I try to get everyone offering something high ticket, at least $1,000, so that you don't have to go out and sell a million things to make a good living. You can sell three, and be in a good standing, as long as it's actual value. And then moving on, credibility. So just, press, getting yourself out there, branding, building trust with your audience. A lot of people try to sell too early. I never let people even sell before, definitely before number 3, with the credibility. I always say you're just giving free value at the beginning for a very, 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 very long time. I try to just wait until, I always say, when someone asking you how much, that's when you charge. You never charge before. Then we move on to organic. It's just simple, just posting and just figuring out which posts can give you the type of reach that ads can. Because like we want to try to figure that out and then amplify that. You have a post that has great engagement, 50 comments, run an ad on that, and then that's how you get into that paid ads. But I always say, if you don't make any money in the organic phase, we can't move to paid ads, because they're not a band-aid. They won't fix you making money. You have to, something wrong.
Spend money and waste it away.
Exactly. And I love that you did marketing as well. And I worked at a marketing company. I had to quit because they were just like, it turned out they were scamming people, and it's
there's a lot out there like that.
Yeah, I was a sales rep, and then I worked myself up to the director's chair. I'm like, okay, and then I get here, and I'm like, oh, you guys are just like, I'm literally saying, hey, it looks like we don't perform well for this audience. Can we stop like selling to them? Can we deny them? Like, nope, we need as many bodies as we can. I'm like, I'm out of here. Can't do that. Can't sleep at night like that. But then after you have your organic, you got your paid ads, just very, very simple. Well, not simple, but just, it's simple as in they work. I just always tell people, if you understand day one that they work, everything else follows. But people, run a bad ad, they lose some money. Now ads don't work, and you're missing out on this beautiful thing that does work. So I always just say that I'm not going to give a whole sermon on ads, but just knowing they work is just the first step. And then if you're committed to figuring out, you'll figure it out. But lastly, removing yourself from the business. That is scaling automations. AI has made this so fun. For me, I've been able to be this one-man show because no one is ready. I had people I wanted to work with me, and just everyone was like, oh, but I'm just like, no, we have to go now. Like it's do or die. But I didn't want to go too long on that, but just target audience, offer creation, branding, organic paid ads, automation, and scaling. And that's just what's worked. I always go free, free, cheap, then high ticket. Those are just always my strategies. But that's just what's worked. I do a lot of coaching, consulting, and when I got into the high ticket, you have to get so creative. A lot of people just want to stand in front of a Lamborghini and shoot an ad. And I actually had a student tell me, like, I love that in all of your content, you're just in your room and you're just, or I'm just in a living room, or I don't want to, I like nice things. I love nice things, but that doesn't mean anything. You or shouldn't, I don't want the fans who think that makes me good, or you think that a nice car makes me valuable. Like, I want to be valuable, for what I'm, giving people. But that's just my little 2 cents. I love business, so I always have to chime in. But just your biggest, I know we're getting a little 15 minutes over the hour there, so I appreciate your time. Your biggest takeaways from today. I gotta say, I love this conversation. I can't wait for this to drop. But your biggest takeaways from today, what would you like to leave the audience with?
I think the biggest takeaway, overall, you may hear my toddler in the background waking up from his nap. I think the biggest takeaway is you need to really try to understand and connect with other people. And in order to do that, you have to understand and connect with yourself first. And whether that be through therapy or some DIY formats or with a coach, you got to do it some way, somehow, or you're not going to be able to understand other people. Even if you're not neurodivergent, that remains true.
Yeah.
Another really big takeaway is, understanding that one bad mental health experience does not define all of them. There are going to be, it's like going to a restaurant. Sometimes you're going to have great food. Sometimes it's not going to be good food at all. You're going to have good and bad experiences, and that's okay. Both things can take up the space. And what you do with that information going forward defines who you are. Are you going to just fall by the wayside and say, well, this one bad experience defines everything going forward? Or are you going to say, you know what? This bad experience happened, but I'm going to keep trying until I get a good experience. Hi, buddy. He's okay, bub. I'm almost done. Sorry. Toddler. Very sad. And then my third takeaway, I had it in my mind until the screaming toddler distracted me.
I know that kind of derailed you.
Right. My third takeaway is nuance. I've mentioned nuance quite a bit. And this one is specific to the ADHDers. If you are feeling like you are coming from a perspective of black and white and all or nothing, or it's only good or it's only bad, you're not living in the gray and you're not approaching things from nuance. And while it's okay to be going through that, what you have to do in order to grow is say, I'm looking at things through black and white, or I'm looking at things through rose-colored glasses. And this isn't reality. I want to live in reality, and reality has maybe in it a lot more than it does yes or no. I'm going to try to live in the middle of things. And in therapy, we call that logical mindset, emotional mindset, and where you want to be is wise mind. So always strive for the wise mindset.
I really personally appreciate that. So I struggle with that a lot, and it's caused actually a lot of problems with, just in relationships or just in partnerships, business partners doing one thing. And I'm like, oh, you hate me. Like, I can't even work with you. Like, and it's like, it's obviously not like that. So I appreciate that perspective because I struggle with that. And I know I get it from my mom because she, like she cuts off people like this, like it's so quick. And if you do one thing, that means that you are bad, so that is something I have to work on, especially with my wife. I know I give her just a crazy hard time, sometimes. And, I'm not the one who's going to say I don't. So, I know I'm self-aware, but right. I really appreciate your approach to everything. That was the main reason why, I was just, really excited to talk, just because it's not that often I get to talk to someone who's just being themselves and offering their perspective. A lot of people just want to tell you what you want to hear and tell you what society, wants them to say, whatever. So, I definitely appreciate your transparency and just realness, the rawness from everything. I would love to, definitely talk more and just love to, definitely talk again if you're ever open. But yeah, I think this has been a great talk. And anything else for everyone just before we end up here?
Ignore the screaming toddler in your life, which might be the negative perspective that your mind is coming from, and try to push through that so that you can truly see reality and grow into the person you are meant to be. You are not defined by the things that happened to you. You define how you come out of them.
I would leave it right there, Sarah. Thank you so much for today. I'll definitely be in touch to get you get the content and all the stuff we get from it. But definitely appreciate your time, and I know you want to get to that, Tyler. But appreciate your time, and thank you for coming on.
Absolutely, thank you so much, Jace. It's been a pleasure.
No problem. Look forward to talking again soon.
You too. Bye.
Awesome. Bye. That was another episode, guys, of the Hyperactive Hustler, and I think we're getting pretty good at these. That was that was just awesome. These talks have just been, helping me honestly so much. Like honestly, with the Preem Pod, I learned so much in the first few weeks. Just getting to talk with Rose, and at that extent, for those of you who know my co-host Rose for the Preem Pod, and he's co-hosted a few episodes here as well. in person. But just when I started the Preem Pod, I mean, that's a more creative podcast, more towards culture, more towards, hip hop, more towards sports. But me and, Rose kind of started off, we didn't know what we were doing. The first episode of the Preem Pod is actually called, we didn't know what we were doing. And he was just dropping just all the gems in his head, and a lot of it was helping me, a lot of stuff about becoming a man and things like that. For those of you who know me, who know my age, like I'm turning just 24 this year. So, people look at me online. The things I do age me, my work, the amount that I work ages me, but I'm just turning 24. So I'm learning a lot. I never say that I'm an expert in anything. I mean, there are some things I feel like I got some expertise in for sure. But, I never say I'm perfect, and I'm always, just a student of the game. And I say all that to say this, I learned a lot today. I'm not, even if the things that I already knew, I just needed to hear it. A lot of those things we don't talk about as often, and I love Sarah's approach when she says, actually saying how we feel. Because the thing is, when you don't say how you feel, when you don't actually articulate that, or when you do hide that, like I'm strong, I'm a really strong believer in you have to say it out loud to even, make it real, to, kind of internalize it. And if you're not even willing to, you know, say a problem that you have, if you're going to actually convince yourself you don't have that problem, it doesn't go away. So it's like I love her approach with that, because I think so many people don't grow because we run away from our problems. If we, and this is my favorite example, and this is the last thing I'll say before we jump off here. But a lot of people, that are recovering, because and Rose will tell this a lot. A lot of people who are recovering alcoholics, they, not even recovering alcoholics, just the day after, let's say the day after they're told that, they have to, stop, or the day after they say like they're not going to drink anymore. A lot of people just tell themselves, I'm not going to drink anymore. And that's the only method of trying. They think that the problem goes away because they said that, and it doesn't. And then when they relapse, they don't tell anybody, because people also think like, what are you doing? Like no one is willing to like actually look into addiction, or look into these things and own up, because people love to say I can stop whenever I want. And then we're 5 years in, we're 6 years in, we have sicknesses and diseases, and all because we just refuse to say I'm actually addicted. Me and my I can't wait to have my friend Chris on here, but me and him, like, we are super honest with, we got addicted to cannabis. We got addicted to weed. It took me a long time to even try it, because my mom told me if I tried it, I would die. So I always thought that until I got to high school. I'm like, these guys are living. So I'm like, maybe it was just me. Maybe I have something, but no, like I found out that, you're good. So even after, I still thought, no, it's not cool. Those guys are trying to be cool. It's lame. But then I finally tried it, and I thought I died, and it was scary. But then I ended up finding a strand. I found indica that worked for me, and it was helping. It was helping with just some anxiety, calm me down, overstimulation. But I'm addicted. I can tell myself, like a lot of people will tell you that I'm addicted. It's times where now I just come home and it's like I needed to smile. If you get too depressed and you're clinging on that stuff, people won't admit that. And on this podcast, we want to talk about the realness. We want to get real. I don't want to talk with anyone. Well, let's say that. I want to be all inclusive, but I prefer to speak with people who are going to be real with me, be vulnerable. Because this is a safe space. And over the episodes, you guys will see, this is where we're building a safe space. We don't want, we don't want anyone feeling bad for who they are. But we do want people to, feel bad enough to want to grow, right? Because it takes you're not going to want to grow if you feel great about yourself, right? You usually want to grow because there's a problem that we don't like, right? I don't want to be the one to tell anyone that you have a problem. It's obviously, I want it to come from you if you feel like you have a problem, and then we can talk about it. But I'm never going to diagnose anyone or tell anyone they need to do anything, unless you are telling me you're struggling with something and you want my help. But I just wanted to say that, guys, because I love that perspective, and I want to just expand on that before we end it here. But this has been another episode of the Hyperactive Hustler. We spoke with Sarah today, and I can't wait for that to drop. Thank you, everyone. We're at 1,200 followers on Instagram right now. We're at up to like on YouTube. I think we got almost 10 subscribers now on LinkedIn. Like everywhere, we're just growing, guys, and I appreciate everyone who's watching, every single one of you. When it comes to podcasting, my last thing for today, because I know we got 2 minutes left. My last thing for today, podcasting, just if you want to start one, just do it. And if you're scared, come on mine. DM us, we can set up an interview or set up something like that. And, you can try it out. 'Cause a lot of people, you overcomplicate it. It seems scary. It seems like you're doing a whole bunch, but I have double screens up. So I do have an iPad. I have my MacBook, and this is my work setup. But you can really do it with a phone. It doesn't have to be extravagant, but just wanted to give you guys some last little gems there and some last little nuggets. Appreciate everyone. I'm actually exhausted. I have not been to sleep. And it is 6 p.m. today, and I have not slept since a long time ago. So I'm going to go take a nap and sign off. I appreciate everyone for watching, and we'll see you in the next episode.
Play the song again for no reason. Let me see it.